Hi, I'm Dr. Mike Narvid. I am a chiropractor. I'd like to thank you guys for having me. Take a little bit of time out of your schedules. I know you guys are busy, high school student athletes. You guys got other, probably better stuff to do. So let's get you back to class as soon as possible. Okay, so what do you guys think chiropractors do? Crack backs, okay. Anybody else? Massage. I get that. So, anybody ever been to a chiropractor in here? Few people. Okay, anybody's parents, guardians, aunts, uncles, grandparents been to a chiropractor? Yeah, okay, a lot more of you. So why did your guardians, whoever go to a chiropractor? Because their back hurt. Okay. So if chiropractors, crack backs, massage backs, treat people with low back pain, why would I be here with you guys? I'm sure a few of you have back problems or something of the sort, but that's not all I do. What I do is, I treat injuries. And I treat nervous systems. So nervous systems, okay, I'll show you something quick. Your nervous system, it runs through this spine. I work with one of these every single day, at least more than one, a few every single day. So your nervous system, at the head of it is your brain. Your brain is think of it as like an outlet. So you go to plug your TV into an outlet. So what that's doing is, think of it as electricity. That is sending signals, your brain is sending signals through your spinal cord, through your spinal nerves, to your muscles or an organ, just to make sure it's working. If it's not working, there's something wrong with the cord normally, right? Or there's something wrong with the TV, something. So what I do is make sure that this nervous system is working optimally. And how do I do that? I can apply small spinal adjustments to these joints, a bunch of these joints throughout the spine. And what that does is relieve pressure throughout the spine on these spinal nerves. Helps your spinal nerves communicate to your muscles. So why is that important? Your muscles, for you guys especially, athletes, I'm sure you guys have a myriad of different injuries throughout the room. What your spinal nerves do, and any nerves throughout your body, all connected to your spinal cord, is communicate with your muscles. They help your muscles absorb force. When your muscles absorb force, it takes more and more pressure off joints. So let's think. Anybody tear an ACL? Anybody sprain an ankle? Anything like that? I'm sure a few of you have, okay, I can see. A few sprained ankles, there's someone on crutches right there. So where was the problem with your ankle? So you might think, okay, the pain in the outside of your ankle. That's not where the problem started. The problem started with muscular imbalance. So what we have is muscular imbalance. Doesn't mean you're weak, doesn't mean that. It just means that your nervous system isn't communicating to your muscles to absorb that force. When your muscles do not absorb that force, that can cause for your joints to absorb the force for them. And what happens when your ankle absorbs too much force, or force in a region that it's not supposed to? That's when it twists. That's where you get the pain. So, for any athlete who has, been injured or just feels that little bit of pain, soreness, is it normal? Yes. But does it have to be normal? Does it have to be chronic? Does it have to turn into something out of control where you're in pain for the rest of your life? No, it does not. If you come to a chiropractor, I can help you learn how to understand your body in a way that you've never been taught. That can help you become a better athlete and just overall healthier person. Thank you for your time. If you guys have any questions, feel free to ask. Thanks.